So effective communication, guys. I'm gonna just go right into this. I think this is the most underrated skill as a physical therapist that a PT can have, because effective communication is everything, right? You are a human being as a physical therapist, and you are treating another human being. The only way you guys can connect is by communicating, right? And if you can't do that effectively, where you are getting your point across and the patient feels like you are listening to their points, then there's going to be a disconnect and something is not going to happen. So I'm going to go through 3 different points today that's going to really help you make more sense about why effective communication is important. Okay, so number 1, we're going to be talking about the value of building relationships and making a connection, which I talk about all the time. Okay, number 2, we're going to be talking about honoring people's struggles. Hope you're taking notes. And number 3, we're going to be talking about taking a high interest in a person and listening to them. So all 3 points that I'm going to be talking about today, I really encourage you to take notes and ask some questions in the comments if you have some questions here, okay? All right, so check this out. Number 1, build relationships and make a connection. Now, I want what every physical therapist should do is that they should absolutely be ambitious to make a good quality relationship. As a physical therapist, you should be enthusiastic to want to make a connection and build a relationship with the patient. Now, I say this specifically because if a patient comes in and you are not willing to go above and beyond, right, ambitious and enthusiastic to make that connection, then that patient will not have a good physical therapy experience. And I talked about this before. If you have all the skills as a physical therapist, but you cannot build a relationship with them, the patient will not come back. And you compare that with a physical therapist that might have mediocre skills, but makes the session fun, engaging, and where they feel like they belong and something's working, then the patient's gonna come back every single time. Every single time. Now that means when a patient is engaged, that means you're gonna build significantly deep rapport with the patient, meaning your level of impact is way better. Number 2, that means the patient's gonna come back. I think what people don't realize is that when you start working as a PT, patients don't come back. If they don't like you, if they don't find value, if they feel like they're just being offed in the session, they're not gonna come back. And the rate of no-shows, cancellation rates are a lot higher than you think. Like you might think as a PT, they're just gonna come to me no matter what. But patients have a choice. And it's a lot of work, it's a lot of investment to come to physical therapy. Imagine spending 1 to 2 hours a week to come and travel to a whole new place, a clinic, and not only go for treatment, but then you have to do homework at home. Bruh, that is a lot of commitment. Which brings me to point number 3. If you don't bring that connection, build that relationship, then the patient is not gonna do their homework. If a patient does not do their homework, their chance of getting better is way less, right? So you always want to make sure that the patient feels wanted, they feel like they belong, you're having a connection with them, so that they will come back to the sessions and that they will do their homework. So then it all comes back to them getting better, which makes you look good, them feel good, and you guys both win. Now, let's look at the negative effects or the opposite effect. If you have a patient and you just have this, I'm just gonna survive mentality. I'm just gonna have them come in, do my minimal stuff, and then I'm out, you know? If you're doing this, then you are killing the potential of creating an experience that the patient can miss out on. And this experience is so important because if they don't have this great experience, then they miss out on potential possibilities to improve. Because let's face it, you as a physical therapist, future physical therapist, you're going to be skilled in what you can do. And I know that you're going to make people feel better. But if you can't have that spark where that first experience or the experience in PT makes them feel good, that emotion, if they don't feel connected, then they're not going to come back in that way. And then you can't showcase your skills to actually help them improve, And I really, really believe that it is your duty as a physical therapist to make this PT experience the best you can be. And if you are not being ambitious to pursue a high quality relationship for your patient, then you are wasting your time, you're wasting your patient's time, and no one's going anywhere. I always say this. I always tell myself this when I treat a patient. If it's a male or a female, I say, look, I'm treating you like you're my dad. I'm treating you like you're my mother. Will I go above and beyond for my own mother or my father? Absolutely. Will I be ambitious to create a good relationship with my own mother and father? Absolutely. And you as a future physical therapist need to be in this mindset of treating the patient and pursuing high quality relationships and making a connection so that you can grow with them and help them improve. Because if you're not, hey, you're doing a disservice to our profession. And if that's you, then you need to leave. Become a PTA. Sorry, become a different profession, not PTA, because that's still physical therapy. Be an OT or something, But physical therapists, we need to push to become a better profession. We need to elevate ourselves. And I am an advocate of making sure that we are growing and growing and growing and building high quality treatment and high quality rapport with our patients. All right? Okay, number 2, honoring people's struggle. This was a game changer for me when I learned how to do this. Now, honoring people's struggles means that when a patient comes into the clinic, you are listening to making sure that whatever they are coming in with, you are acknowledging, you are honoring, and supporting that struggle. Because let's face it, right? They're coming in because they have some sort of limitation. Let's give a shoulder pain, for example. If I strain my shoulder, have some kind of rotator cuff tear, I am coming to you as a physical therapist because everything in my life is affected by this. I can't reach up to grab something on the top of the counter. I can't put on my shirt. I can't wash my back. It's hard for me to pull up my pants. These things that we do every single day is now limited because of my injury. And you as a physical therapist need to honor the patient's limitation and struggle. Okay? So on top of the limitation, you also need to make sure that their pain is addressed and that you are absolutely acknowledging that as well. Now, it can be sometimes annoying when every patient comes in for an entire month and constantly says, it still hurts. it's still in pain. I still feel limited, which happens. Patients will say that all the time. But effective communication is to divert their attention to not their pain and what they're limited in, but rather divert it to where they came from and how much growth and improvement they made from the time that they started. And that is something, when I learned that skill, that always helped me. So let me give you an example. If a patient comes in and says, it still hurts, I still can't reach and do these things. Okay, that's fine. What's the pain at right now? It's like a 2 out of 10. All right. Do you remember when you first came in, a month ago? Do you remember how you told me that your pain was at an 8 out of 10 and that you couldn't even sleep? You couldn't even reach above your shoulder level because of how painful it was and how you couldn't scratch your back or wash your back? And from a month ago, you made some significant progress. You went from an 8 out of 10 to a 2 out of 10. You went from barely reaching over your shoulder to now actually reaching above your head. You went from not being able to sleep and waking up 5 times a night to having to sleep a good and full night rest. That is significant improvement. And if we made that improvement in 1 month, what can we make in a couple more weeks or 2 months, right? And so acknowledging their struggle and to positively reinforce that is going to be absolutely crucial for you to build that therapeutic relationship, because patients are coming in and they feel hopeless. And when you provide and plant that seed of hope, then they believe. They believe that they're going to get better. They believe that you have a plan for them and they're going to improve. And when they believe, then we go back to point 1, they're going to come back to the sessions. They're going to do their exercises. You got to help them see, look, I was hurting, I'm still hurting, but I made I made a lot of progress since the beginning to now. Wow. This thing is actually working. Let me do more exercises because this is like improving my life, right? So these things are so important to make sure that you're honoring their struggle so that they can and will and do feel heard and valued. Which brings me to my last point, which is taking a high interest in them and listening to them. Now, what does that mean? Taking a high interest in them. Have you ever had an occasion where you met somebody random at a party or a gathering and they just ask you a lot of questions about your life? What are you studying right now? What school are you in? What is your major? Oh, you're trying to get into physical therapy school? Where are you at in that process? How many more years do you have left? Oh, you want to become a physical therapist? What kind of specialization do you want to be? What's your family like? What else do you do for work? When people ask you a lot of questions, you feel like they're interested, right? You feel like, oh, hey, somebody's interested in my life, right? Someone besides my significant other or my parents are interested in my life. Doesn't that make you feel good? Doesn't that make you feel special? And if you feel special, doesn't that make you want to talk to them more? Have a maybe like, oh, okay, I can build a relationship. I can connect with this person. So making sure that you take a high interest in your patient can make a big difference in the session. Now, I'll never forget, one of my bosses told me during my first couple weeks while working, he said, you can go to anybody and you can connect with them in these 4 categories. And these 4 categories are the acronym FORD, F-O-R-D. Now, FORD stands for family, O stands for occupation, R stands for recreation, and D stands for dreams. You can literally go to any person down the road, random stranger, and if you talk about one of these 4 things, you're gonna make some sort of connection. And so when he taught me that, that was another game changer for me, because I learned to connect with patients in a different way than just like talking about their pain or talking about physical therapy things. Like, those are all great stuff, but if you can connect on deeper things than just physical therapy, the patient and you click better, you know? So, number 1, always asking open-ended questions are super important, right? So taking a high interest in them and asking them open-ended question. Open-ended questions basically means anything but just a one-word answer. So a lot of times, who, what, when, where, why, and how types of questions are open-ended. So I always like to do a what with the Ford, F-O-R-D, Ford technique, and then follow up with a why. So for example, family. I'll say, what is your family like? Do you have siblings? What is your relationship to your brother, sister, mother, father? And then I'll say, why are they so important to you? Why do they influence you? Right? And then, or we go to occupation. What do you do for a living? What do you do for a living? Why did you get into that? Did you choose to go to that profession, or did you choose, or was that chosen for you? If you can do another profession, what would you do? Right? And these are just good conversation starters. And one question will lead to another question and will lead to another question. And the whole time when you're asking them, all you have to do is listen. Just nod your head, acknowledge what they say, do a little, yes, right, yes, right. You know, do a little affirmation to tell them that you're still listening, and then keep following up with more questions and more questions. Some other technique that really has a lot of power is being okay with pauses, silences, right? You don't always have to feel like you have to fill the conversation with things to say. And honestly, that goes against what we're trying to talk about, because you should be listening more than filling in conversations. When you listen more, the patient feels heard. And when they feel heard, they feel valued. When they feel valued, they're going to come back because they feel like you know them. When they come back because they feel like you know them, they start improving and they listen to you, and then they do their homework. And then my hands are getting out of this screen because they're gone. They're elevated to a place where they don't need physical therapy anymore. Effective communication, y'all. This is the one skill that I learned in my 1 year of being a physical therapist, of how important this skill is. And I can tell you now, if I don't effectively communicate to the patient, if I don't practice making a good relationship with them, connecting with them, honoring their struggle or their pain or their limitations, and if I don't listen to them, they leave. And it has absolutely happened to me. It has absolutely happened where they just said, you know what, I don't want to come back. And patients will no-show, they'll cancel, and they just won't come. So building that relationship is absolutely key. Listening and having that effective communication is super important. But guys, that is what I have for today. To understand that effective communication will make or break your PT career. So I thank you so much for watching today's video, and I really appreciate your time.